Come here, my friend. We are talking about the tips you need to follow if you are looking at getting pregnant faster. Tips you follow if you are looking at getting pregnant faster. And without further ado, we are going to talk about the reproductive system. Gerard Massa, the health educator, is the name of the channel, and you are most welcome here. If it's your first time on our channel, remember to subscribe so that you do not miss any new videos we release every day at exactly 17 hours. So looking at the reproductive system, you realize that it is having the two parts. These are known as the ampular part of the fallopian tubes, and then it is also having the two ovaries around this area, and then the ovaries have what we call the ovarian ligaments. These are the small tissues which hold the ovaries in place. And then we have this thick-walled structure, also known as the uterine wall. It actually contains 3 layers of tissue. That is the outer layer, known as the perimetrium, and then the inner layer, which is known as the myometrium, and then the innermost layer, known as the inner lining of your womb. In medical language, you call it the endometrium. So we are looking at how best you can optimize your system, how best you can optimize your reproductive system so that you get pregnant faster naturally. So we are looking at the ovary today. In our video lesson today, we are talking about the ovary. The ovary specifically plays a very big role for you to get pregnant. If you are looking at getting pregnant, we are going to talk about the ovaries. The ovaries specifically are responsible for a process known as oogenesis. Oogenesis is specifically that process whereby the ovary produces the egg cells. These egg cells are known as the mature Graafian follicles. Why are we talking about the ovaries and then also relating it to how you can get pregnant faster naturally? We are talking about the ovaries because for you to get pregnant, there are 4 things which need to be in order. Your ovaries should be undergoing this process known as oogenesis. Your ovaries should be able to produce the egg cells. If your ovaries are not undergoing this process of oogenesis, then there are high chances that you will actually have difficulties getting pregnant. So your ovaries should be undergoing oogenesis. In simple terms, your ovaries should be able to produce mature egg cells on the 14th day of your menstrual cycle, that is on the ovulation day. Then next, your fallopian tubes should be patent, or your fallopian tubes should be open. If at all your fallopian tubes are having issues, if you have adhesions are basically tissues, collections of tissues or collections of scar tissue which resulted from maybe poorly treated urine tract infections which went upwards, ascending up to the tubes. So if you are looking at getting pregnant faster, it is very, very important for you to investigate, to do some tests to confirm whether your fallopian tubes are patent, whether your fallopian tubes are open. And the test your doctor will normally request is what we call the HSG scan or the HSG investigation. HSG specifically means the hysterosalpingogram. The hysterosalpingogram, it's an examination whereby a small chemical, also known as a contrast dye, is introduced through your private parts, your V, and then this chemical ascends upwards up to your tubes, and if at all it reaches that specific part of the tube where there is a blockage, either due to free fluid, also known as hydrosalpingitis, or adhesions in the fallopian tubes, then that contrast medium or that chemical which was injected into your tubes will collect around there, and when a scan is done, it will show that yes, the blockage is around this particular part of your tube. So we are talking about your reproductive system and then relating it to how you can get pregnant faster by simply optimizing it, by simply optimizing your health. So we've said that the first step is your ovaries should be going, or your ovaries should be able to release the egg cells. Also, in simple terms, your ovaries should be able to undergo the process of oogenesis. And then next, we'll say that your tubes should be viable. Your tubes should not be blocked by free fluid or adhesions. If your tubes are blocked, then your doctor or your specialist will do some tests or will do some procedures in the theater whereby unblocking of the tubes will be done. And then next is that your endometrial lining, the inside of your womb, should be viable. It should be having sufficient hormonal levels. When we talk about hormonal levels, we are talking about the first hormone known as the E2 or estrogen, and then the next hormone known as progesterone. Now, progesterone, from our videos, we've talked about progesterone, and we have said that progesterone is a pregnancy-friendly hormone. It's a hormone which maintains growth of that embryo, growth of the baby, from the early stages up to that mature stage, or up to the 9 months when the pregnancy is ready. So that hormone, also known as progesterone, normally is high. It is high on the 2 weeks leading to that time when you see your periods. The main reason is that progesterone rises because it is anticipating a baby, it's anticipating a pregnancy, and thereby it is getting ready. So it gets ready, or it brings about, it plays its major role by making sure that your uterine lining or the inside of your womb is ready to receive the baby. So if you are a woman and you have tried to get pregnant, you have a history of recurrent miscarriages, then it is high time you discuss with your doctor and you discuss about doing some tests. The first test is to look at your levels of progesterone. The next test is to look at your thyroid function. You need to make sure that your thyroid is secreting the hormones and within the normal ranges. The hormones we are talking about, which are being released by your thyroid hormone, include the T3, the T4, and then the TSH, also known as the thyroid stimulating hormone. Because there are many chances that your recurrent miscarriages, the pregnancy loss you are undergoing, could be due to low levels of progesterone. The good news is that when you do these tests and then discover or identify that you have low progesterone, then you will actually be put on progesterone supplements. Do not self-medicate yourself. You need to talk to your doctor. This video is for health education. It's for informational and educational purposes only, to make you aware of what is happening. When you are aware of what is happening to your body, when you are aware of what is preventing you from getting pregnant, then you will make wise and informed decisions. So, my friend, we are saying that you welcome to our channel, Gerard Massa, the health educator. Remember to watch videos like this every day. Just hit that bell, that subscribe button below, and then also hit notifications to allow to be able to see videos we release every day at exactly 17 hours. So we've said that you need to make sure that your progesterone is okay. Whenever you get pregnant, progesterone is going to rise. The main reason we've already talked about is that it is to maintain the pregnancy. Then your estrogen levels are going to drop. So when estrogen rises instead of dropping after you've got pregnant, then there are going to be issues and you need to have yourself checked out. Actually, high estrogen levels automatically make pregnancy to be difficult. Pregnancy cannot happen when estrogen is very high. And elevated estrogen or very high estrogen. Estrogen is a hormone. If you are wondering what estrogen is, it's one of the hormones which are released by your ovaries. Specifically, what happens is that in your brain, there's a part known as the hypothalamus. The hypothalamus is a very important part in the brain. It plays, or it does lots of other functions, but in fertility, we are talking about fertility on this channel. So the hypothalamus releases a hormone known as the gonadotropin releasing hormone, and then this hormone goes to the anterior pituitary gland, which is just below the hypothalamus, and then it makes the anterior pituitary gland to release the two hormones. These hormones include the FSH hormone and then LH. FSH means the follicle stimulating hormone. In simple terms, follicle are the eggs. So follicles. Hello my friend, welcome for today's lesson. This is Gerard Massa, the Health Educator. I welcome you to our channel. If it's your first time here, remember to subscribe so that you do not miss new videos we release every day. On this channel, Gerard Massa, the Health Educator, we talk about the ovulation calendar, we talk about the ovulation calculator, and we do also give pregnancy advice. Remember to subscribe so that you do not miss any videos we release. I welcome you, my friend, and watch up to the end because there's lots of information, lots of good tips for you today. Have yourself a good time watching this video. I welcome you, my friend. Thank you.